Hey, Rosemary, welcome to the show.
Hi, Brittany. Thanks for having me.
Absolutely. I actually heard you speaking on another podcast and made my whole team listen to it in terms of your insight on the differences between women and men and COVID-19 vaccine. And so I made my team listen to it and I was like, I would love to have her on the show. And I have the best team ever. And they reached out to you and got you. So here we are.
Well, thanks. I'm glad you did.
Yes, absolutely. Well, let's kick off the interview with talking about your background. So our listeners love to hear about our guests, where are they from? What did they study? Have they always been interested in women's health? If not, what did you do before? And how did you end up here? What do you do now?
Sure. Yeah, I wasn't sure how far you wanted me to go back, but so I'm actually from Canada originally, and from near Vancouver, from a town called Squamish. It's a small town about an hour north of Vancouver. And I have kind of a funny path, I suppose, to getting to where I am now. In my undergrad, I went to the University of British Columbia in Vancouver, and I studied theater, technical theater. And then I decided that wasn't really what I wanted to pursue. I finished the degree, but I went into sociology and was very interested in equity and just in equity in general. And from there, I actually moved to the United Kingdom. I went to the University of Edinburgh, where I studied policy studies, and got very interested in health policy, particularly from a global perspective. So that led to a PhD at the University of Leeds, specifically looking at HIV policy in Tanzania. And a couple of years after graduating, I taught in the UK at the University of Leeds. I actually went back to the University of Edinburgh, very strong interest in sexual reproductive health, maternal health. And then I came to Johns Hopkins to work on a project that specifically looked at integrating gender analysis into health systems research. And I'd been doing a lot of health systems research previously. And from there, my passion for gender really grew. Gender analysis, women's health is part of that, but also interested in, men's health and gender minority health. Mm-hmm. And just how does gender as a social determinant affect health, like everyone's health?
Yes, absolutely. It sounds like you were interested in sociology, right? And then you were like, okay, how about equality within sociology? Oh my gosh, health inequalities amongst it, right? It kind of it sounds like it all built on each other, right?
Yeah, it did for sure. I was always interested in where are the biggest inequities and where can we address them? And I think that's sort of where my path went.
And you think that there's such inequalities in health that it kind of stood out to you, right?
It did. I mean, particularly from a global health perspective. So the inequities in health between low and middle income countries really stood out, particularly women's health, maternal health. It's still high to this day. I think if we're looking in high income countries like the United States and Canada, gender inequities and racial inequity and the intersection of the two is still huge. It's one of I think the biggest gaps in health.
Oh my goodness. So you study sex and gender analysis. First, can you tell our listeners what do you define as sex and what do you define as gender? And then, what does it mean to analyze it?
Sure. Make sure I get the definition of sex right, but sex and gender are definitely different, and they're often conflated to be the same thing, which is incorrect. Sex has more to do with our biology, our chromosomes, what we're born with at birth, just in lay terms, and whereas gender is socially constructed. So it's what a given society considers appropriate for a man and a woman in terms of the attributes, attitudes, behaviors, and then how does that then shape opportunities, for example, and chances, and what happens when you don't fit within that given structure of what's socially acceptable. And then sex and gender very much do intersect. So different socially constructed notions of gender, behavior, attitudes do impact our biology, right? So I think they're very hard to disentangle sometimes, but they are different.
And what implications do they have in health? I mean, I think it's obvious the sex part. So females, they literally, the chromosomes are different, right? You have two X chromosomes instead of an X and Y. But we've also talked a lot on the show about metabolism being different. You know, men's metabolism is 30% faster than women. So oftentimes women are the ones that are cold in the workplace. Like literally, like on a biological level, there's differences. But what about gender? How does gender affect your health?
Yeah, no, that's a great question. I think there, as you're right, there's like some of the sex differences are really clear to see. I mean, one of the simple ones is around maternal health too, the type of health that women need as a result of their biology. Gender, on the other hand, I think it try to find the right way to say it. It affects and shapes our health by the ways in which gender inequities manifest.
Yes.
So they manifest as potentially inequitable access to resources, and that might be income, education, knowledge, time. Time as a resource, inequitable division of labor and roles and practices. So who does what type of work, and what are the risks of that work? The fact that women do more care work in the home and might lead to different levels of stress. It manifests the different values and beliefs of what's appropriate, and then what happens when you don't. And values. One example with men is particularly this idea of masculinity is about needing to be healthy and strong. It leads to delayed healthcare seeking, which has a direct effect. Whereas women's actually roles and care roles actually puts them in interaction with the health system a lot more. Is actually a bit more protective in that sense. But then we also have decision making and autonomy, and especially in some contexts, women might lack more decision making and autonomy around not only how to use financial household resources, but how to whether they can go to the doctor at all, whether they can leave the house, and all of this factors into health. One of the big examples as well is around behavior. Again, what's socially acceptable around, like we see among men, things around drinking and smoking, which is connected to non-communicable diseases like cancers. But however, as societies shift, and particularly as societies become more gender equitable in terms of opportunities, education, jobs, we see more women taking on these traditionally masculine roles, like our behaviors, like smoking, maybe more drinking. So we are seeing that there's that shift in relation to health.
I always think it's interesting talking about gender and like drugs or addiction, because Alcoholics Anonymous, the book is written in a male perspective. Like there's literally a chapter in the AA Big Book called To the Wives. Like if your husband's an alcoholic, this chapter's for you, because like women aren't alcoholic, obviously. And that book was written in 1930s. It's like not even 100 years ago, right? And the whole book is like only men are alcoholics,
Yeah,
and
that's
now I think there's actually, I don't know the statistics, but I think there's might be like the growth in women joining 12-step programs is faster than men.
Oh, sure. I'm not surprised by that.
Yeah, you're like, yeah,
no,
I would. I can't love that.
Especially during COVID, right?
Yes.
Uptake of it. But you've actually touched upon another key sort of gender ways in which gender affects our health, and that's more how gender bias is embedded in our systems and structures. And like the health system is one of them, research, clinical research is another. So, what gets studied, what questions get asked, what's assumed, like the example that you gave, the fact that it was assumed that more men are alcoholics, but the ways in which women drink might be very different from what men drink, the ways in which men drink. And perhaps we need different strategies, right? But because we haven't studied it or looked at it, this is a big gap.
Absolutely. And what gets funded and what doesn't. I was actually just talking to a woman the other day. She was on this like design team for like this heart monitor, and this team of engineers brought out the prototype, and she was like, that looks like a maxi pad. And they were like, what are you talking about? And she was like, let me show you. It like took out a maxi pad. She was like, Nate, nobody gonna want to wear this on their chest. And they were like, uh-oh. like millions of dollars from almost making a medical version of MaxiPad. So yeah, we need women in the room, right? We need us in the room.
For sure.
Do you see us like starting to, is it really, really rare for us to start to integrate sex and gender into our research and our analysis of health? Or is it like a trendy thing right now? Like, where do you see us on the spectrum? Are we starting to gain some momentum? Or are we still like, don't hold your breath?
Sure. I really think we have seen change, particularly in the last year, in relation to COVID-19. I think COVID-19 has brought attention to sex and gender that we've never seen it before. We've seen so much more in the news, in the media, and yes, it's in relation to COVID-19, but the hope is it will branch out to other topics. We have seen an increase in attention, especially over the last 10, 20, 30 years maybe, right? And there's still a lot of gaps. Like funders such as the National Institute for Health in the United States or the Canadian Institute for Health Research, they've played a big role in requiring those that are submitting proposals, for clinical research and other types of research to factor in a sex and gender analysis. Canada's really led this by providing a lot of guidance on what that means. However, still a lot of people aren't doing it, or they're treating it like a tick box exercise, or they're equating gender with women's health. That, if I'm looking at women's health, I'm doing gender work, which is not true, right? It's just you can do gender in relation to women's, men's, or gender minority health, and you can also be quite gender biased if you're looking at just women or just men. So we've seen this shift in funders. We're still seeing, a big example with COVID when the COVID-19 vaccine trials, yes, women were included, which is great because women have been historically excluded from clinical trials. And it wasn't until the 1990s that they were included, which is like, I remember the 90s. That's just ridiculous. Yeah. And even with the clinical trials, yes, they included women and they looked at outcomes by sex, but with the adverse reactions, they didn't disaggregate the data, that particular outcome or data by sex. So we had this data that was aggregate, meaning everyone was lumped in together. And then not only did they not disaggregate the data by sex, they didn't ask sex specific questions. So here's this like gender bias of it's already, there's this big gap. So if you're not asking women, oh, did you have were there any side effects that maybe only pertain to your female body, like your menstrual cycle or, other things that might be, which we're seeing anecdotally people talking about now. So yeah. There's these huge gaps. We have seen a shift. There's more attention, but we still have a long way to go.
I, as a scientist, I just don't understand how they didn't tease that apart and study it because, we at Femtech Focus, we do a lot of research. So we research the industry in general, and I will sit for hours on Google Sheets teasing apart this, or what if I, structure, we have a database of about 620 femtech companies, and I love to tease it apart. Who's working on menstruation? Okay, if you're in menstruation, how many are US based versus European based? And, and I just tease apart because you don't know what you're going to discover. So like when you say like, oh, they just summed it up. They said, here's the column of adverse effects. Let's just like equal sum, add it all together, publish it. Like, you think it was maybe because they were like rushed, or like that it literally is just like not part of the protocols that people like, it's not standard for people to think about teasing it apart?
Yeah, I don't think it was because it was rushed. Obviously, they have that data. I mean, they know who's a man and who's a woman. I mean, we even saw that with early days of the COVID-19 pandemic when the data was coming in. There's a great tracker called Global Health 50/50 as this whole sex disaggregated tracker for COVID-19. It's great for data, and they've been looking, tracking it from the early days and which countries have the data and which don't. And one of the things that we found is some of the countries were reporting on differences in the beginning, but then once it got to a certain number of cases, they just sort of stopped. But obviously we know people's sex and gender. And I just think it's this inherent bias that's in the system. It's all that this virus, with pandemics, it's a little different because we've got the phrase is the tyranny of the urgent, which is something my colleague, Dr. Julia Smith at Simon Fraser University has used in at work. That when we're dealing with like really urgent issues, we sometimes sideline some of these other issues that we think are less important, but clearly are really important. But I think it's just this inherent ingrained bias, and it goes all the way back years when, before the 1990s, when clinical research, medical research only included men because they were worried that if women were pregnant, there might be harm to their fetuses, or maybe their biology, their hormones might change things. So everything was, if it worked for the male body, it worked for everybody. That was sort of the assumption. And I think we've just got this inherent bias that's just ingrained, that people aren't really thinking of these differences. And this is a little bit, one of the things, I haven't totally fleshed out this idea, but in the 90s, 2000s as well, this idea around like women's equality, is the same. And I don't know if you see on some discussion boards online, I like to read some of the comments. I don't go too deep, but people are like, well, I thought women were supposed to be equal to men, right? I thought and I'm just thinking, it's not about equality, it's about equity, right? Yeah. And I don't know if we've had there was this shift around what equality and people not understanding what equality versus equity, and that we are different. Our biology is different. The norms and social norms and activities that we do is different. It doesn't mean one is better than the other. It just means that we have to factor this in and incorporate it.
Yep, absolutely. 100%. It's really insane. I think we are in an era of talking about equality and disparities and equity, and it's not one size fits all, and therefore everyone gets one thing. It's that we need to consider that women are not just little men, or that Black people have different experiences in the world than white people, or gender being, constructed by society. Well, Rosemary, did women and men have experienced COVID-19 infection differently? Did one gender get infected more? Were the symptoms worse in one gender than the other?
Yeah, it's a good question. And again, if you look at the aggregate level, so if you look at all the data together, we see a pretty similar pattern or rates of infection among men and women. However, we have disaggregating the data in different ways is really important. So if you look at specific countries, you will see different changes. So I'm looking at the global level. Yes, we saw similar rates of infection, but in some countries we saw higher infection rates in men and others higher infection rates in women. We don't always know why. In some cases as well, around thinking about mortality, we saw higher, for most of the data suggests that more men have been dying, or, get more severe outcomes from COVID, and we're dying because of COVID. But in some countries we see a flip. And some of that, Canada is an interesting example because of the number of deaths in care homes and the fact that women live longer than men, and there were more women in care homes. That really drove the data. I mean, I think also data gaps, if there's gaps in the data. Going back to infection, one of the interesting things to consider is profession. And if you think about healthcare workers, so yes, of all healthcare workers, around 75 to 80% of all healthcare workers are women.
Wow.
So you would expect more infection rates among them, but we saw a disproportionate rate of infection among women healthcare workers compared to men. So, even though you might see the data on the whole suggests that we have equal rates of infection, if you actually unpack by, different demographics, different characteristics, you see different things. And the same thing with mortality. I mean, mortality on the whole, yes, more men are dying, but in some contexts, the story's a little bit different.
Yes. Oh, that's really interesting. You brought up women living longer, being in nursing homes. I'm like, oh yeah, that could affect the data. And you got to think about those other touch points and details when you can't, correlation is not causation, right?
Exactly.
So, Like we believe in science on this show, obviously. Okay, so we talked about the virus. What about the vaccine? So luckily women were included in those trials, thank goodness. But we're seeing that there were some adverse reactions. And, I've been running Femtech Focus for about almost 2 years, year and a half. And I've learned a lot about femtech and women's health and the disparities, yet every single day, I feel like I still learn. And so when they first took the Johnson & Johnson thing off the market, the vaccine off the market because of adverse effects, I started to hear a bunch of people say, yeah, well, women are mostly the ones who have adverse effects anyways from vaccines. And I started to dig into this and I was like, oh my gosh. So could you tell us about some of the adverse effects that women experience more often than men do?
Sure. So I've mentioned this before, it's important, to recognize that our biology, men and women's biology, is different. So women do respond to vaccines differently. And it's because women tend to exhibit a greater immune response to vaccines, which actually tend to make vaccines work better in women. And this is, due to how our hormones or estrogens, make up the functioning of our immune system. Also, interesting, I'm sure you know this fact, but the reason that 80% of all autoimmune diseases afflict women is because of women's more robust immune system. Side effects, often a lot of the side effects that are counted and captured are minor, very mild, and they're also often very short-lived. And I've done a lot of I work a lot on influenza, so looking at sex and gender differences in influenza, particularly the influenza vaccine, and we saw the same thing. Women reporting greater degree of side effects. Again, most of these are quite mild: soreness, swelling, redness. Those are localized side effects. The more systemic side effects are considered things like flu-like illness, headache, sore throat, and again, both things men and women experience. It's just that women tend to report more. Of course, you have to think about, is there a reporting bias? When I'm always thinking about gender and gender norms, and are women more likely to report? Maybe, that's just something you need to consider. We have seen, and you're right, with COVID-19, but this is anecdotal because, again, the original vaccine trials did not disaggregate the adverse reaction data by sex, is the more sex-specific side effects. So women reporting changes to their menstrual cycle, it coming earlier or later, being heavier or more painful. And I think there's more than enough women have been saying this, that researchers are picking it up and now studying it. And other side effects around women reporting enlarged lymph nodes in the breast area. So when they went to see a mammogram, it affected the results. And of course, this led to questions around fertility. Is there an effect on fertility? Which we don't have the answers. Most things that I've read is no, we don't. Yeah. But again, people aren't really asking the questions. But the thing that's important to know is it's similar to what we're seeing with COVID is not different from other vaccines, like influenza, like other types of vaccines. Women do report greater adverse events or side effects, which are mostly mild, than men. And it does have a lot to do with biology, with our more robust immune systems.
Have you ever heard of a vaccine affecting a woman's menstrual cycle before?
No, but probably because no one ever asked.
Yeah, it probably has been affecting our menstrual cycles forever, but it's never been a shot that everyone in the world is getting. And so therefore we're talking about every change that might happen, right?
Exactly. But you said correlation is not causation. And that is really important to think about with vaccines, because so many things are happening in our lives at any given moment, and women's menstrual cycles change all the time. We all know that. If we've had us women or people with female reproductive organs who had menstrual cycles know that it changes pretty, you live in a dorm, menstrual cycles sync up, right? Which is weird. And so just because we need more data, we need more research, because if a woman says, oh, my menstrual cycle changed, we're okay, but we know there's lots of other factors that might be at play there. So we really need the research. But again, people need to ask those questions. With a gender lens, the way I refer to it, and this is speaking to the researchers, when you want to bring in a gender lens to your work, yes, sex disaggregated data is important. yes, well, intersectional sex desegregated data is important. So looking at among group differences, like maybe Black women versus white women might experience things differently, you know, different ages, looking at those intersections. But you can bring in a gender lens to a sex-specific study. So a sex-specific study is just among women, right? Or just among men, as opposed to a sex desegregated study, which includes both women and men. But if we're bringing in the gender lens, we have to make sure we're asking the right questions, right? Questions that might only pertain to women, might only pertain to men. And if we're not bringing that lens in right from the very beginning, we're going to miss really important things. And this idea around the menstrual cycle and changes to vaccines is one of a really perfect example of that.
100%. And so do you have like a quick takeaway suggestion for those listening? Like, do they need to bring somebody in, like you in, and like to help them make up the questions, or like, what is the best strategy? I know we have a lot of researchers that listen as well. And so how do they get started to being, you know, gender and sex woke in their research?
Yeah, bringing in someone with gender expertise or looking at sex as a biological variable or gender or both, like they're different perspectives, is important. So there's this argument, and we've seen it, we have got years of data, right, where gender mainstreaming is this idea where we're integrating gender and gender lens into everything. But we know that it doesn't work per se, because everyone thinks it's somebody else's responsibility and it gets passed around. Whereas just having gender as a side alone, its own thing, doesn't work either, because it doesn't get mainstream. So it's like you need a combination of the both, but then you need that gender expertise to look at where we can integrate it and mainstream it, because it's so important for every part of the stage, and for people to ask those questions that we might not be thinking about. And there are tools that we can use to systematically apply a gender lens to the work that we're doing, and just to ask the right questions. Like, how are men and women being affected differently? How are men and women of different groups, different racial, ethnic, minority groups, age groups being affected differently? And it's like kind of bringing a different perspective to the work we're doing right from the very beginning.
Yeah, I feel like I often hear about differences in like adult women and men in terms of like side effects, or did they study them or not? Did they consider gender or not? Like, do you know about any case studies that have to do with children and gender and like sex and them teasing it apart? Like, I haven't heard of any, so I'm just asking you.
Oh, off the top of my head, no. I mean, I'm sure I could have a look in the literature. We might be able to find something. We have a review that was published quite recently that we looked at different age and sex, but I don't remember a lot on adolescence in there.
Exactly. That's what I'm thinking.
Yeah. Yeah. But, and the interesting thing is thinking, like with vaccines, I'm thinking about dosages, right? That kids get a different dose than adults. I don't know what the COVID-19 guidance is among that. I know younger kids are getting the vaccine now, but the interesting thing is if kids are getting different dosages, whether that does not have an effect, I don't know. They're getting less. I was talking to someone once who was like, she says, we were online, so I didn't see what she looked like. Well, I saw her, but I didn't know her body or how tall or anything.
Yeah.
And she's like, I'm a very slender, slim woman. So when I was bringing my kids in to get vaccines, I asked for that vaccine because my body size is similar, right? Because they're thinking about the dosages, which got me thinking, it's like, why are we having that perspective with children, but not perspective with adults, thinking about, oh, women have different body types, maybe we need different dosages.
Yeah, apparently if you're a child at 120 pounds, you know, like maybe you're an adolescent high school boy who's in football, but if you're a grown woman who's 90 pounds just because you're petite, you know, like, but no, you're an adult, you're over 18, so you get the over 18 dosage, right?
Yeah, it's
interesting.
Yeah, you raise an interesting question around children. I don't know the answer to that. I think we'd have to go back and look. And I'm sure there's some people looking at that. But the question, I'm like thinking about it from the gender lens, dosing question.
Yeah, totally. I have one last question about the COVID-19 side effects and, research. They didn't include pregnant women in the clinical trials for the vaccine. And so I know when I was hearing them say on the radio, like, go get your vaccine, like group 1 can go get it. If you're pregnant or breastfeeding, talk to your doctor. And so I did a little Instagram story and was like, okay, physicians, like, what did the CDC tell you that they didn't tell everybody else about pregnant women and breastfeeding? And, physicians were replying like, oh no, we don't have any secret information. They're just giving us the responsibility to decide. Like, they didn't tell us anything else. And so, okay, so let's put a pin in that. So that's kind of a messed up system, right? Like, primary care physicians, you can figure this part out. But, there's people said, women are they unknowingly pregnant getting the vaccine in the clinical trial, after the clinical trial. So eventually we're going to find out how the vaccine affects, the fetus and the baby. And so it really got me thinking about including pregnant women in clinical trials, because sure, there's like, and I'm not just even talking about vaccines in general, but all drugs. There's a certain amount of like, you don't want to risk the health of the fetus or the baby, but it's going to happen anyways in the real world, right? Like, and so we might as well monitor it rather than like let it happen in the real world. What is your take on that? Should pregnant women be in clinical trials?
Yeah, from an equity perspective and like thinking about the sex and gender lens, and the fact that pregnant women tend to be some of the most vulnerable group, for different reasons. Yes, they should be, I think, but it should be very much based on it, like informed consent, like what it is. But we should be allowing women to make that choice for themselves. We have this historical knowledge and perspective of pregnant women and vaccines now. We see similar patterns with Ebola and the Ebola vaccine, and like pregnant women actually being they weren't able to get it, and they were very vulnerable, and pregnant women that were getting COVID, what it was the vulnerability there. So I actually think it's from an equity issue. Yes, it's very important that pregnant women are included in clinical trials, but very much from an informed consent perspective, like you said, highly monitored. It's not like we're going in blind, like we don't know the ways in which vaccines work on bodies. Like they might be a little bit different, but look at all the vaccines that we have. Yeah. I mean, I'm not a biologist, I'm not an immunologist. I mean, I'm saying that based on my own, but from an equity standpoint, from a gender lens, I think it's unethical not to include pregnant women in clinical trials.
Yeah, 100%. Cool. Well, because that's what I've been thinking. I've been settling on that in my mind. Because for me, it's going to happen anyways. Let's at least monitor it so we can record it and we can report it and learn, right? So interesting. Well, Rosemary, this has been awesome. I definitely would love to have a glass of wine with you and just think about all the ways gender and sex affect healthcare and research. And it's literally my favorite topic. We have 2 last questions that our listeners really like. The first one is, we have a lot of aspiring founders, a lot of university and grad students. So if someone wanted to start a Femtech, like women's health and wellness innovation company, what's an area that you think still needs innovating?
Sure. Well, I can think of 2 examples, particularly related to COVID-19, that kind of emerged as issues. They weren't caused by COVID-19. They, just COVID-19 exposed different inequities that were already there. One is the need for personal protective equipment that adequately fits women's bodies to keep them safe, and the other one is around thinking about the need for sex-specific dosing around vaccines or medications. So thinking about, like, in regards to personal protective equipment, I've already mentioned how women healthcare workers were disproportionately impacted. And again, some of this evidence is anecdotal, but it was more women reporting that they were failing their fit tests from the mask, right? They just weren't fitting their bodies. So a lot of the personal protective equipment out there is designed for the male body. We see that in construction work. We see that in the police force. We see women having to alter their bodies or having to take things off, or not being able to be as efficient because of what they're wearing, but it has huge harmful effects. So we really need personal protective equipment that's designed for different shapes and sizes, particularly related to the woman's body. In relation to the sex-specific dosing, We know that vaccines, women and men interact with men's and women's body differently. We know that medication does, right? There's examples of Ambien is such a big example that's always used of how women should actually be getting half the dose, 5 milligrams and not 10. And we know that because there was a link between car accidents and women who took Ambien the night before, right? And then we also, there isn't as much research on vaccines, but there's at least one study I know of that found that women receiving half dose of the influenza vaccine had the same results as men receiving the full dose. And because women have a stronger immunal response, what does that mean in terms of the adverse reactions? And then to me, does that link to vaccine hesitancy? And then prevent women from going to get the vaccine? And yeah, these are questions that I have that we need to make sure that our vaccines or medications, that we have sex specific dosing and allocations for them. And a lot of people just aren't asking these questions.
Yeah. Sex specific and potentially even just weight, specific as well, like you're talking about, right? Because even women, like, again, I always joke around like, oh, we're not just little men. And sometimes I think to myself, well, sometimes we're bigger than men.
Like, yeah, true.
Like women are all different sizes. And it's so interesting. I did not know about the PPE, the personal protective equipment, and it, not being, fitted for women necessarily. We had a product designer on the show who talked about surgical tools are made for the man's hand, and ergonomically a man's hand and a woman's hand, there's not much overlap actually. And so, and that scrubs are too long, generally. And so Filipino nurses are like the number one gender and ethnicity of nurses, and their scrubs are rolling around on the floor of hospitals. It's like a public health issue, actually, and so I didn't even know about the masks, but that makes a lot of sense.
Mm-hmm.
And then what do you think the femtech, the women's health and wellness industry as a whole, needs the most right now in order to be successful?
Yeah. Well, do you know what? I think we need more diverse voices. So more like support for women, but also particularly minority women entrepreneurs, people that are thinking about these problems in different ways. Having diverse teams, right, is so important with these different perspectives. There's I'm sure you know this, but research has shown that women entrepreneurs are actually more successful in terms of revenue, but male entrepreneurs are the ones getting the money. And we know women entrepreneurs are more likely to design products and things that work for women. But again, we need that intersectional perspective, making sure we have diverse groups of women, diverse voices. The other thing I think is more research and advocacy in the need for sex and gender integration. So whether that's specific research, thinking about what products, what technologies really work for women, which is what Femtech is doing, right? But I think we just need this advocacy angle is so important.
Yeah, 100%. Well, thank you for all the research you do, because it adds to what we're doing. And, we just want to make sure that women are well and feeling well and living well. And that can't happen when our masks are made for a man's face and not ours, right? It can't necessarily happen when we're not considered in trials. So thanks so much for the research you do and taking the time to chat with us today.
Thanks so much for having me.